And with that, I would like to hand over to Jan Philipp, who has a very special guest to conclude today's catapult session. Jan Philipp.
Thank you, Kurt. Thank you so much. First of all, congratulations to a great catapult series. It was fantastic to watch. Now, it's about to start with our closing ceremony, our closing remarks. I would like to begin by again, thanking all of you for joining us for the EIT Health Summit series. I think it has been a wonderful 2-week journey with participants from across the globe, actually, and of course, all the healthcare ecosystem. Now, we're really pleased to see the participation from so many different stakeholders, as community and collaboration is, of course, really of vital importance in the advancement of health innovation that we are all here for. And I hope that you have enjoyed the different insightful presentations. I hope you have made valuable connections and also engaged in fascinating conversations, even though this has happened now all online. Now, as we move forward, we hope that you reflect also on the topics that we have discussed during the Summit series and consider how you can inspire change within your own organizations and, of course, within your reach. I would like to thank also all our partners in the EIT Health community, our innovators who've shared so much during the various Meet the Innovator sessions. And please all remember, EIT Health has an open door. Come and join us. Now, building strong European health ecosystems is also a priority, of course, for the European Commission, particularly also Maria Gabriel, the Commissioner for Innovation, Research, Culture, Education and Youth. The last time I spoke to her was at the beginning of the COVID-19 pandemic, and I'm still very grateful to her extraordinary support to the EIT and also EIT Health to enable us to respond fast. We're now thrilled that Commissioner Gabriel joins us to close our Summit series. Good afternoon to you, Commissioner. We are keen to hear your views on the EU's contribution to developing innovation ecosystems. The floor is all yours, and we will be listening. Thank you very much, Commissioner Gabriel, please.
Thank you, dear Jean-Philippe. Ladies and gentlemen, it's a great pleasure and honor for me to be here. Congratulations, Magda. Thank you very much, Christina, for your touching words. I was there for this part of the ceremony. But allow me now to start by saying thank you very much, Jean-Philippe. Thank you to your colleagues in the EIT Health for organizing this 2020 EIT Health Summit. I'm pleased to speak to you in this closing session that has been 4 days of interactive and inspirational conversations around healthcare innovation. And I would also like to congratulate all the promising biotech, medtech, and digital health startups taking part in this final stage of the training and competition program of the EIT Health, the Catapult. I wish you and your innovative solutions to thrive so you can become transformational leaders and play an important role in the recovery of our European economy. And not only for Europe, it's about a global level that we are talking here. We fully believe in you. Now, allow me to start by stating why startups in health are so important for us. First, of course, there is a general remark about small and medium-sized enterprises. They are the backbone of Europe's economy. But startups in particular boost high qualified job creation and growth. And they are key to our Europe's competitiveness, our capacity to innovate, and our strategic technological leadership. And as medical developments zoom ahead, health startups are increasingly leading the change. From young teams springing out of Europe's best medical universities to entrepreneurs twinning up with expert clinical practitioners who have found a problem to solve, there is no shortage of European medtech startups revolutionizing healthcare. Allow me just to share with you some numbers. A recent paper on innovation in medical technologies published by the European Trade Association for the Medical Technology Industry, MedTech Europe, stated that there are more than 32,000 medical technology companies in Europe, and SMEs make up around 95% of the medical technology industry. More than 3.5 billion euros was invested in health startups in Europe in 2019. This is the third largest sector after fintech and software, with a year-over-year growth of about 80%. And startups are perfect for early-stage product development as they offer an agile environment that allows for the required flexibility to quickly change strategy or direction. That's about the positive side. Of course, we have weaknesses. There is a substantial market failure in Europe that makes it difficult for startups to get funding, especially at the early stages. They struggle with raising capital, which is a significant obstacle to their progress and commercial success. In the concentration of innovative companies in only few member states, is a symptom of the innovation divide in Europe, which we need to address. So what we are doing as European Union to help these critical actors for our health, economy, and society? Of course, what we try is to develop solutions to overcome those challenges. Our science, education, research, and innovation initiatives in health are all about working together across borders, sharing each other's knowledge and resources, as well as improving our health and care systems together. And the EIT is a great example and success story of European innovation. After over 10 years of operation, the EIT innovation model is working and delivering impact on some of Europe's greatest societal challenges. The EIT has established a trusted network of around 1,200 partners across Europe. The EIT has supported over 2,500 startups and scale-ups with more than 3.3 billion euros in investments, creating more than 6,000 high-skilled jobs and bringing over 900 new products and services to the market. And EIT Health, in its turn, it's a vast, vibrant community of some of the world's leading health innovators, working across borders and disciplines with approximately, Jean-Philippe, you correct me if that's not true, 150 EIT health partner organizations, harnessing the brightest minds in healthcare from the world of business, research, and education to answer, definitely to give us concrete answers to the biggest health challenges across Europe. And the pandemic now brought new challenges. I would like here really to say thank you very much, EIT Health, because during the crisis, you have seen how much your network, your expertise, your innovative capacity is the right tools that we need in order to give response to this COVID-19 crisis. I remember in early April, the first round of companies that were selected, the 14th health innovation projects. After, in May, what we have seen is 207 innovation projects and ventures from 32 countries, all these with concrete impact. And I'm very much grateful for your efforts and for your delivery. Now, what is important is that during the crisis, what we have seen, how important is to have complementarity between the innovation instruments of Horizon Europe. And I'm very glad to see already now, during the pilot phase of the European Innovation Council 2, a very good development in collaboration between EIT and EIC. And until now, over 200 startups have already benefited from a combined support from EIC and EIT. That means that now I'm going to my last point. We have weaknesses, we have strengths, but what about the next step? What we can do more to support health innovation in Europe? And what I would like here to say is that while there are many tens of European, national, regional innovation programs across Europe, there is not a well-structured framework to provide consistency and direction to all the political and financial efforts from public administrations to spur innovation. Therefore, I'm convinced that a bottom-up European innovation area is needed to tackle many of the challenges ahead of us in the area of innovation. We have to complete the knowledge triangle with focus on regions and reducing innovation divide. And that's why my proposal is to continue to support startups in the health sector, but I would like to propose to you to co-create together an European innovation area, a European innovation area that is a blueprint of the way forward for the next 4 years. That means that we need to ensure tech autonomy while providing consistency across the numerous existing programs to increase effectiveness, with a focus on the regional diversity to reduce the innovation divide, and encompassing technological and not technologically driven innovations to increase diversity in the ecosystem. And for me, this European innovation area will be complemented, will be in synergy with the European education area and the European research area. And here that will be up to all of us to continue to work together with some of the other initiatives, with the European University Alliances, with the joint roadmaps between industry and research organizations involving startups and innovators in the new European research area, to see how we can assure better synergy between the EIT and the EIC, how we can really build new innovation ecosystem work program, and how the European Health Union will really be strengthened thanks to your experience and to your partners and to your winners today. So allow me really here to finish emphasizing that COVID-19 also offers an opportunity for health startups to disrupt the health market in Europe. While health market in Europe had been relatively close to startups until now, the size of the home healthcare market in Europe was worth 70 billion in 2019. It is now estimated to reach 105 billion by 2024. Therefore, the potential for the EU health startups is amazing, and all our winners today are proving that. So what we need now is to translate these opportunities into long-term structural and systemic changes in education, research, services, and industries. And that means increased cooperation. And I think that that's the only way to manage the health crisis, to be better prepared for future crises, to accelerate the digital and green transitions, and at the same time to create and deploy. That's the most important, those new and innovative solutions. So that's my main message today. Congratulations to you, you deserve it. At the same time, Jean-Philippe and all the entire team, please continue to stay so much engaged, involved, committed. Let's build together a European innovation area where all these talents that we see today, they will grow and they will continue to make us proud of them. Thank you very much.
Thank you so much, Commissioner. This is for your warm and truly encouraging words. I'm really, I'm amazed. Thank you so much. Of course, we will be there to make our contribution to such a European innovation area. I think it's what we ought to build together. I think indeed, forging the better collaboration also between the different European actors there, that's where all of us can do our part. I honestly think that the collaboration between what we do in the EIT and the EIC, I think that's a very low-hanging fruit, and it's so obvious and so logical, and it's good that we are taking the first step. I believe that working with those that own the needs, like the healthcare providers, in our case, the GPs, those that are really in the business of delivering healthcare, is so important. It's important that we have them in and see their views. But also, I think what I would like to add is that when we're talking European innovation area, we also need to include the connection to the private sector, also those that are investing. I think that's extremely important. We've taken good steps also with the Commission's support now to create what we call the Venture Center of Excellence together with the European Investment Fund to make sure that those of you who we have been awarding today and the startups also have the chance to leverage investment, to get access to larger investment rounds in Europe. I think that is a very, very important piece that we should also make happen in that innovation area. Thank you so much, Commissioner Gabriel. Allow me now to move to a few takeaways from the summit, because as hard as it is to believe, we are at the end of it. Just reflecting on some of the ideas and discussions that have taken place during the summit series, I'm struck how far we have come, that we are already talking about a not too distant future where transformative solutions to some of our greatest challenges become sort of an everyday reality, such as the examples we heard from Christina of 1928 Diagnostics on the use of cloud-based software to support screening in hospitals that really help tackling antimicrobial resistance, a huge problem that is out there. We are not here talking about the same things each year. We are truly seeing progress, and often rapid progress. And I do think that with all reflection also on weaknesses and challenges, we should also credit ourselves, each and every one of us, for contributing to this, as change is never, ever easy to achieve. So during our session last week on AI, we heard from John Halamka from the Mayo Clinic that a shift in care delivery is being facilitated towards the delivery of really complex care in the home, as opposed to within hospital or clinical settings. I think that was a very, very good contribution. And it's really of vital importance, as with a growing and also aging population and a continued rise of chronic conditions, multimorbidity, we simply must work smarter, right? So we have to make use of technology to collect, organize, and deliver insightful data that can inform the efficient use of resources and save our limited clinical resources for when they are truly needed. Also in the AI session, we talked about that it is important for our citizens that they are provided with the opportunity to stay out of hospitals, continuing to be cared for in the comfort of their own homes. So we heard wise words, I think, from Berta Lanmesco on the future of the healthcare workforce, and the insight that while AI will not replace healthcare professionals, of course not, we'll have more of them, but healthcare professionals who use AI will replace those who don't. So this is a fundamental reality that we must plan for with education, talent, and skills to ensure healthcare professionals transition into this digital world. Now, in our session on high-value care, we were reminded that the transition to high-value care, so to care that puts into focus the outcomes that truly matter to patients, it doesn't demand necessarily system overhaul, but instead a refocusing of resources already available and harnessing the passion of healthcare professionals to make a difference to patients. So while it was agreed that changes in reimbursement structures, data acquisitions, and outcome measures, they would help, but I think all the speakers we've had urged us that the foundations for high-value care are already available. They just need to be agreed and enforced. So the resounding message from the speakers was, stop talking about it and start small and build from there. And a number of organizations have already done that. And we've also heard from a number of those pioneers in the different sessions, and also from the panel. Peter van der Bay from Santion, for example, shared their case where in just 18 months, Santion innovated process and organization to reduce reoperations by up to 74% in some of their locations. And they also reduced the unnecessary hospital stays by 30% across 7 of their hospitals. And that, of course, is not only an advantage for patients, but of course, it also saves and contains costs. And finally, in our third session on new business models, I think it was equally fascinating. And we heard about what considerations need to be made in business modeling for modern healthcare products and services. So we learned that regulatory and reimbursement frameworks are slowly opening up to the changing pace of healthcare technologies. And our speakers urged that stakeholder collaboration is really the only way to unlock market access for innovative digital solutions now and in the future, because regulators and those that reimburse cannot predict everything. We're talking about novel solutions and therefore novel approaches that can only really be found together and in collaboration. I go back to Christina, the CEO of 1928 Diagnostics, as an example that we shared during the session, to look into how business models that are more prevalent in the tech business can actually also be introduced in healthcare, and that she sees those accepted within the next 5 years. To conclude, I would like to say a huge thank you to all of our speakers who offered their expertise and the experience to us during the Summit series. Thanks to the EIT, Martin Kern, who's been with us today, to the European Commission, again to Commissioner Gabriel, for your important and enduring support. I would also like to thank all of the EIT Health innovators and partners who presented their solutions in the various sessions, and of course helped in the preparation, and our teams who moderated these sessions and prepared them. And finally, big thanks also to our whole comms and events team, their work in making all of this possible, despite being faced with the significant challenge of moving all of this online. And I think you've done very well, because you did not just copy paste stuff online, but you actually designed a totally different event compared to what we had last year. And that's exactly what was needed. Now, thank you. We look forward to seeing you all next year, 2021, the EIT Health Summit. I'm not sure in what format yet. Hopefully, we'll meet face to face again, but we'll make everything work. And I thank you very much. And it's my honor now to close the EIT Health Summit. Thank you.
Thank you. Bye-bye.
Wonderful. Jan-Philippe Beck, CEO of EIT Health. Now, just before we close, a big thank you for everyone who made this summit possible this year. Virtual events always come with their challenges, but I think we've managed to deliver a thought-provoking agenda that touched upon the most critical topics in healthcare innovation. And of course, a big thank you as well to my co-host for today, Kurt Hulle. Now, despite this being a remote audience, there was a lot of networking going on, so I'm sure there were made some valuable connections there as well. And it's good to see that our EIT Health community is growing despite the lack of face-to-face contact. If you have missed any of our earlier sessions this week or past week, or simply want to rewatch some of the content, you can. It's all been made available online on the registration site. Now, thank you to everyone, and we hope to see you soon. On behalf of our entire team, stay safe and goodbye.